Good evening, everybody. Tonight I was going to talk to you about the regulators, but more importantly, I'm going to talk about the case itself and the need for a public inquiry. This is such a serious matter. Brian was killed in the care of the state, the NHS. I say this as he was held under an illegal, incorrectly implemented DOLS. Nicola Marsh had falsified almost the entire contents of the DOLS form, and it was done without a capacity test, therefore illegal. False imprisonment. This is punishable by up to 10 years in prison. She also falsified notes and put them in as untimed, typewritten sheets with no resemblance to the actual contemporaneous notes of those days. Before this, over a period of 9 days, he'd been dehydrated, starved and neglected. On the 25th of September, I was wrongfully and willfully accused by Martha Scott, Nicola Marsh and John Trezise of giving Brian unprescribed furosemide, which was totally untrue, and it was prescribed, and he took his own medication as he told them. But this gave them an excuse to get rid of me, and that is precisely what they did. 1 hour the next day and never again. The PSOW has upheld all my complaints, and so I'm not saying anything which is not in the public domain. They breached his human rights and they took his voice. It was also held that they breached my human rights too. And the next day, when I was not allowed to visit, they gave him a medication which they admitted much later on, and they said that it was in error. But however, 90 minutes later he was dead. My forensic examiner said this is the most likely the cause of his death. I was not even told he'd become seriously ill. The hospital tried to cover it up for months. Their own report was full of inaccuracies, commented the PSOW. It was also grossly defamatory against me. It was held that Martha Scott misled the coroner and Brian's brother. Brian's brother insisted on a post-mortem, and they found a tumour the size of a tennis ball. This was obviously the cause of his low sodium. It was staggering that the staff did not realise how ill he was, comments the PSOW. And it breached hospital policy to stop visiting. And it breached our human rights. The DOLS policy of the local health board was also breached. My forensic examiner said medication error, if I was there, probably would not have happened as I would have pointed it out. As well, the week before, he had been stopped attending an outpatient appointment to discuss the CT scan from the 25th of August. Instead, this illegal DNA CPR was filled in by Alina Ionescu, saying he was confused and had no relatives. That's a crime in itself. Poor Brian was never going to escape from that hospital or that ward, and I could not save him. So where now? Surely this cannot be allowed to go on. Carry on regardless? Pretend nothing's happened? No, we need accountability. The NMC have met and had several talks with the Anara and Bevan Health Board. This is not, it's not kosher. It's not correct. It's highly irregular. Nothing short of a public inquiry will save the NHS in Wales. This has met the bar. It is gross negligence, manslaughter / willful neglect causing death. These nurses need sentencing. Eluned Morgan and Albert Heaney must now organise with NHS Wales a public inquiry. I am appalled at the complacence of the Welsh Government so far. There needs to be at the very least a review. The Ombudsman's report was not without conflict of interest due to the fact that the respiratory consultant they used was in the same society as the staff involved in the Royal Gwent. Something like a trusted to care review, which looks at patient safety and prevention of future deaths, breaches of human rights which were so violated in this case. Time limited, terms of reference decided, and taking no more than 1 month. Brian was let down by the very people he trusted to help him: the hospital, the NHS, and the Welsh Government. Thanks, I'll update you on this.